Coalition. We are really excited to see you all here this morning. Before we get started with some of the content we have today, I'd love for everybody, starting with the folks in the room, to go around and introduce themselves if you don't mind. So I'm going to popcorn it to Veronica to kick us off, please.
Good morning. My name is Veronica, and I am a prevention specialist here at Southside Behavioral Health. And I will popcorn it to Stephen.
Thank you, Stephen Wilson, member of the local recovery community and longtime member of the Wellness Coalition. Go ahead and send it over to Dennis.
Dennis Damians, partnered with Veterans Resources. Haven't been here that long, enjoying it every time. And I'll pass it over to, see who's up top. Oh, I'll pass it to Kenan since she's next under Veronica. Never mind.
Kenan, you're on mute.
Oh, no problem.
There you go.
Good morning, everyone. Kenan Tyner-Smith, Prevention Director of Southside Behavioral Health and Fiscal Agent for the Coalition. I'll popcorn it to Tiara, who jumped on here early as I did.
Good morning. I am Tyner-Smith. I am the elementary school counselor here in Brunswick County at Maharan Powellton Elementary School and Red Oak Sturgeon Elementary School. I am going to popcorn it to my colleague, Miss Seward.
Good morning. My name is Emma Seward. I'm the school counselor for Tatara Elementary School in Brunswick County.
Amy, I'm a ping pong it to you if you don't mind.
Can I ping pong it to Mr. Hudson?
Oh, sure. Yeah, I'm happy to do it. Hey, y'all. Good morning. My name is Liam Hudson. I have the privilege and honor of serving as the current chair of the Southside Wellness Coalition. I'm also the co-founder and CEO of the Lean In Project based in South Boston. Pleasure to be here with you all this morning. And I'm going to kick it over to Amy.
Hi, I'm Amy Trent, and I'm here for Virginia Legal Aid Society. We provide free legal services to the communities. And I'll pass this to Allison.
Hey, everybody. I'm Allison Byrne. I am the Community Engagement and Partnerships Coordinator at the Richmond, Virginia VA, and I work with the suicide prevention team there. I'm not sure who's gone yet. Brian.
Good morning, everyone. My name is Brian Price. I am the program coordinator for the Virginia Rural Health Association. And I will popcorn it to Alexander.
Hey, good morning, everybody. My name is Alex Adler. I'm the Virginia Partnership Development Manager for Groups Recover Together. And I believe Tyner-Smith is last or possibly last. So I'll toss it your way.
Went already.
You already went. See, this is what I get for not having everybody on the same little screen over here. Whoever has not gone, I guess we'll throw it that way.
Thank you. Miss Kimberly, I believe that's you.
I'm sorry. Am I just supposed to be introducing myself? Oh,
Yes, please.
let the tone go. Class changes. Hi, Kimberly Gordon. I am a teacher at Halifax County High School. I sponsor 2 clubs, Peer Mediation and YOVASO, which is Youth of Virginia, speak out about traffic safety.
Great. Thank you so much. All right. I think that's everybody. I'm scrolling through my attendees here. If I missed anybody, please charge it to my head and not my heart. I'll just pause real quick, give folks a second. All right, hearing none, I'm gonna roll right along. So welcome again, everybody. Very, very excited to see you all here today. Gonna turn it over to our October 17th minutes so that we can approve those really quickly. I'll just scroll through them for you all to look over. You also should have received them via email, and they are on our website as well. Can you all see the October 17th? Did my screen switch? Okay.
We can see it. Uh-huh.
Thank y'all. All right, so I'll
Mhm.
just scroll really quickly. All right, so those are the meetings from our October 17th meeting. Does anyone have any questions, concerns, or revisions before we approve? All right, hearing none at this time, I'll call for a motion to approve, please.
I'll make a motion to approve the minutes as they've been displayed.
Thank you. I hear a motion. Do I hear a second?
Second.
All right. Thank you all. So the 10-17 minutes are approved. Moving right along. Very excited about our special guest this morning. You heard from him just a second ago, but we're about to learn a lot more about what he does in the recovery space and how he's helping Virginians reach their goals of sobriety and sustaining their goals of sobriety. So at this time, I will turn it over to Mr. Alexander Alder. Thank you so much.
Awesome, thank you. Let me share screen here and see if that'll pop up for y'all. All right, can you guys see that perfectly all right?
We can.
Awesome. So, like I said in our introductions, my name is Alex Adler. I'm the Virginia Partnership Development Manager. So I cover the whole state. I am located in Williamsburg, so not as central as it is to get around easily for a lot of folks, but I like to say I work out of the back of my car. So one of those traditional as I go kind of thing. The biggest reason why I wanted to jump in on some of these coalitions down in the South is our fastest growing site right now is our Martinsville location. And a lot of our members come from the surrounding counties, and a lot of them said, hey, are you doing anything in these coalitions? Are you doing anything here? Are you doing anything there? So quite a few months ago, I reached out to Liam and Kenan and said, hey, I would love to join the coalition, see what I can be a part of, and the opportunity to present was here. So here I am today, and I thank everybody for letting me present. So quickly named this Connecting Communities and Partners to Groups Recovery Together. I usually will call us groups or us if that comes about. So just getting started, we are an evidence-based outpatient addiction medicine or MAT services program. So we are level 1 ASAM, so kind of below PHP, IOP, residential, all those kind of things. And we have a 3-pillar kind of system that works around our model. So the first one obviously is our evidence-based group therapy practices, traditional, led by a lot of
I'm so sorry.
Don't worry about it.
There we go. There we go. Okay, there we go.
Am I good to go?
You're good to go.
Awesome. I just saw it popped up muted. Did I say something wrong? So it's led by traditional, like I said, CSACs, LCSWs, anybody who's licensed in the clinical space. It can lead these groups for a lot of our folks and a lot of our areas and offices. Mixed with that is the medication. So traditionally we use Suboxone. However, we are kind of navigating towards different prescriptions. The only one we currently do not do is methadone, and I don't think we will. So the folks who come to us or call us or get referred to us who need methadone, we will send them to a methadone clinic. We are completely fine with that. Understand that everybody is a fit for a certain program. So right then and there, we'll talk about that again later. But we do offer some other ones. So like I said, historically, traditionally, Suboxone, oral naltrexone. And moving into the Sublocade area and a couple of our other states that are piloting that. So my fingers are crossed we get injectables here in Virginia, or at least we work with partners who can provide those as well. So the last kind of pillar is our access to our recovery support specialists. And that is basically your basic traditional care navigation style team. They will work on finding any kind of help for social determinants of health. So the biggest need that we see here in Virginia, right here, is any kind of behavioral health needs. Hey, I need XYZ above and beyond my substance use treatment. The next one, as we see, is just your general providers and places to go for dentistry and things like that. And then we get into the housing, transportation, childcare, stuff like that. So this was 2021. We just asked for a new one for 2023 and 2024 to come out. And they said, hey, it looks similar. Go ahead and use that for now. But we are getting an updated one that I should be able to provide for the coalition here by the end of the week, or tomorrow, I should say. So fingers are crossed on that one. But traditionally, that care navigation team will work around finding any kind of help we can. If we need to refer outside for other agencies, that is something that they do their best at. So we work with all sorts of partners, but kind of our ongoing map of somebody who is to call or be referred to groups. We have a 24 to 48 hours intake. So we're pretty rapid access here in Virginia right now. I would say we're less than that 24 hours. If you call us before 3 o'clock that day, more than likely we're getting you in that afternoon or even early the next morning. The team is working behind the hours constantly of trying to make sure that time is limited, and then we're not extending times because we know capacity could be a lot for some folks. And when somebody in recovery wants recovery, we need to act now and act fast, and we know that. So even if they're not the right fit for us, we're going to call our partners or other community folks and say, hey, we need to get them in as fast as possible. They're ready now, kind of thing. So that's part of my job, is work on those partnerships, not only with folks like Department of Corrections, coalitions, hospitals, those places like that, but other MAP providers, other counseling firms, things like that, to say, we need this and this person is ready, kind of thing. So they get in, they do their intake with clinical and prescriber. So that prescriber more than likely will prescribe the Suboxone. So they meet with their doctor, usually about an hour, hour and a half. And then from there, they're put into their group. And that group is whatever their the person's next availability is. So we call our folks members. We don't call them clients or patients. They're our members of our program. And we're all in this together is kind of our hope there. So they will get into that group. So if that member says, hey, today's Thursday, I did my intakes, I'm ready, I can do a group tomorrow on Friday, we will get them into the first group that they're available for on Friday. If not, we'll provide a bridge prescription all the way to the next one. So if it's a Monday, a Tuesday, next Wednesday is their next availability due to whatever they have, we'll provide that bridge, and then we go from there. So that, what I say by that bridge script is that gets them to their first group, and then from there we provide 7-day scripts. So that 7-day script will be a part of our app. So the cool thing that kind of sets us apart from most folks is, yeah, we have our in offices. You can come on in person, be a part of group, those things like that. But really what sets us apart is the fact that we can do telehealth and virtual stuff. So you hop in a Zoom call just like this. And it's right there at the appointment sign. You click on it, log in, and it pops you into your home group. So what I mean by home group is you are in with the same 10 to 12 people every single week. And that 10 to 12 includes your counselor, your prescriber, office manager will pop in, take attendance, do those kind of things like that. And from there, it's smooth sailing, and you provide all your paperwork on here. You submit all your UDSs, and when I say submit your UDSs, we're making sure that people are just taking the Suboxone or their medication as prescribed. If anything comes back illicit, then that starts a conversation piece with their counselor, prescriber, or do we need to provide a higher level of care, etc. So we are a harm reduction style program in that sense. We also will not kick somebody out for testing illicit on anything, and it's not a 30-day wait or anything like that. So we've actually had some folks that recently got arrested, started their time again, and the jails have called us and said, hey, we want to keep them in group. Can we figure this out? We've had people join and then forget that they missed their first group and then hop in the next week. So we're very understanding. We like to meet our members where they're at, which is a big thing for us. So that's kind of our system, our providers. Most of our RSS, which is that recovery support specialist team, are peers. We don't bill for any peer support services. They're just all underneath the same kind of programming with our clinical bills. So that leads into that kind of wraparound service leads into our numbers, which I like to take a lot of pride in. Here in Virginia, that retention rate is hovering right there around the 71%. I would like to say it's 70.8, and it fluctuates, of course. But as a company, we are almost 2-3 times the national average or the industry average. And I like to attribute that to, one, the telehealth is an easier option for a lot of folks. And two, we're meeting the members where they're at. So if somebody doesn't have transportation or lives out in the middle of nowhere and can't get into a clinic or an office setting or whatever it may be, it's a lot easier for them to attend group. It's also a lot easier for somebody who's working 40, 45 plus hours a week. They can do a group at their lunch break one time a week, things like that. So that brings me to kind of the style is 1 hour a week. You meet with that provider, you meet with the counselor, your office manager, and it's traditional evidence-based. So when you look at the grand scheme of things, you're not going into an office, sitting one-on-one with a counselor or even just your doctor, and then they prescribe you something and you walk out. You're creating a community, you're creating peer-like and supported systems in that way. Plus, you're meeting with very vulnerable doctors because doctors are part of group as well. They're also not wearing the lab coat that pops in. So you're like, oh, that's the doctor. It's who? Your first group, you're wondering who the doctor is. And then all of a sudden they start speaking up and then they get involved and they're very vulnerable in conversations as well, things like that. A lot of our counselors are in recovery themselves or have gone through all their trainings and things like that. So they even become vulnerable at times as well and talk about a lot of things. A lot of groups, I would like to say, go on a very based curriculum, like the evidence-based, like I was talking about. But if something pops up at the beginning of group and they need to do some trauma-informed care or working on saying no, things like that, kind of, they'll change group because they understand how it can go. So here's our footprint here in Virginia. We have 11 sites currently. Closest one to Southside Coalition kind of area would be the Martinsville area. And I think a lot of places that we look at are hot spots. So the darker the area it is, the more folks we have in that area. So you'll see right there around Henrico, Colonial Heights, Richmond is gray. That's because it's so dark that we wanted to make sure that people could see their surrounding areas because otherwise it just gets filled up. Other than that, this is our current census. Which is another reason why I want to be a part of the coalition and things like that. We understand that our program is not a fit for a lot of folks, but our program is a fit for those that may not have transportation, or like I said earlier, live in the middle of nowhere, have a history with not being able to show up to appointments, things like that. So yeah, I think that's kind of it. Besides this is my job right here. This is my slide. This is the people that I work with. I would like to say on a week-to-week basis or day-to-day basis, all depends on kind of my focus in the week or the month. But anybody and everybody that I can help out with, like I said, our other folks that are in the MAT service programs, I would love to partner with them and make sure that we can get people into the right person or the right person and the right people for care. Other than that, that is basically the quick rundown of groups. I can send out some forms after the meeting to Liam or Kenan to make sure we get whatever else is needed out there. But I'm open for questions if we can do that.
Okay, there we go.
Yes, Alex, Stephen Wilson. So this is primarily then just for opiate-based recovery?
Yeah. So historically, traditionally, we succeed in opiate use disorder. That's not saying that we've had some others come in and have been successful on the program. Those that are and I'm totally dropping the word now, and it's so sad because I come from a clinical background. The folks that are coming in on stimulants as well and things like that, if we need to provide another level of care, like I said, we certainly will. However, historically, because we're so involved with a lot of things, we can cover that in group therapy plus our one-on-ones if they need some break off time, things like that. But historically and traditionally, yes, opiate use disorder. Awesome. Well, if anybody has any other questions, feel free to post them in chat, but I won't hold up the coalition. So if I'm tossing it back to you, Liam, it's all yours.
Thank you so much. I did have a question.
Yeah.
Are you connected with the Virginia Tech? They're doing like a survey analysis specifically of Halifax County, Henry County, and I believe Henrico, but I might be lying to you on the third one. But anyway, I think if you're not connected, they would maybe be a great source because they are trying to work with a lot of folks experiencing specifically opioid use.
Yeah, absolutely. I think we've had one of our office managers reach out or has been reached out to regarding that, but I will check in and see. But it's something I'll follow up with you on and make sure that we are,
Okay.
provide whatever data we need to.
Cool. Great. Thank you.
Absolutely. Thank you.
All right, so I'll pull my notes back up here. All right, thank you so much, Alexander. That was great. Everybody give a round of applause. I really appreciate hearing about the different resources that we have across the state, especially as we know that substance use disorder is a prevailing issue across our state, and definitely something that we as the coalition are very tuned into. So thank you. Just making sure there are no other questions. All right, hearing none, I'm going to move right along. Next up, we have updates from the leadership team. We did hold our meeting last week. It was a short meeting for us to discuss the upcoming election cycle. As some of you may know, we will be opening up the election for 3 open positions on our leadership team coming in December. So currently there are 2 open seats on the team itself, as well as the chair position. We have had 5 nominations so far, and 3 folks have accepted their nominations, but also want to open it up to you all. So if you have anybody you'd like to nominate, please email myself or Kenan so that we can reach out to those folks and see if they would like to accept. But otherwise, we will be announcing the folks who have accepted their nominations at the December 19th meeting. Following that meeting, we will send a survey with those of all individuals out to the members. And then we ask that you all please vote at your earliest convenience, and the folks who are voted onto the leadership team will be announced in January. Any questions about that or any questions about the nomination process? Very simple. You can just send me an email with a name. It's really helpful if you give me the contact information and a little bit of background, what the person does, what their position is. And that way I am more informed. If I don't know them already, I'm a little bit more informed when I'm reaching out to them. All right, hearing none, I'm gonna move right along. Just a reminder, please email me if you do have any. Coming up in, I think, February 3rd through 5th. Did I get those dates right, Kenan? Is our CADCA forum. This is a national forum held in National Harbor, Maryland. It is all of the coalitions across the nation coming together. It's also a bunch of different federal partners, including the DEA, who are presenting on the work that they're doing across the nation, the trends they're seeing across the nation. We currently have 4 people signed up to go this year, including one of the new leadership nominees, if they are voted in and accept. And so excited about that. Kenan, anything else to add around CADCA?
No, not this time. If you're interested in attending, definitely have to let us know.
Okay. And I think I said February 3rd through 5th, but it's actually February 3rd through 6th. So like Kenan said, please let us know. This opportunity, with the exception of travel to National Harbor, is a free opportunity for all leadership or all members of the coalition. It's a really, really wonderful educational opportunity. They usually throw a couple of fun things in there as well. One of my personal favorite things about the CADCA Forum is that we get to go to the Capitol building and meet with senators and legislators and discuss some of the initiatives and priorities in our region. And so it's a really wonderful opportunity to get one-on-one FaceTime with the decision makers at a federal level. So like Kenan said, just let us know if you're interested in going. It's a really great opportunity. Okay, Alexander said he may be interested. Kenan, you wrote that down? Okay.
Yes, I did. Yes, I did.
Thank you.
Great. Thanks, Alex.
All right. Any questions on the CADCA forum? All right. Well, Kenan, am I turning it over to you for the TARP update? I don't see Chris.
Yeah, Chris and I have been working on a newsletter blast. She has created a one-pager on all the accomplishments of TARP in 2024. So I'll be meeting with Ellen, of course, who does our marketing, to then utilize our mass mailing that we get from the coalition newsletter to create a mass mailing out of this announcement about the Trauma-Informed Care Network. We plan to put that out probably a couple times with the holiday season coming, to send that out in November, and then, no, take that back, early December, and again in early January. Christine is developing a membership campaign. I think on her behalf, I can share that she is looking for folks to be joining and helping with the Trauma-Informed Care Network.
Thank you. So again, if you're interested in joining the Trauma-Informed Care Network, you can let either Kenan or myself know, and we can connect you to Chris Pennington, who is the chair. All right, so next item on our agenda is our COC update. Our COC coordinator could not be with us today, but the key updates that we have are we currently are serving at maximum capacity for both our rapid rehousing and transitional housing programs. The coordinated care system is in the process of applying again for their permanent supportive housing funds. And so that would give Tri-County, who is the lead agency for the continuum of care, 3 different housing program opportunities for folks in our region. They do serve 4 different counties. So they serve Brunswick, Charlotte, Mecklenburg, and Halifax County. So when we say continuum of care, that means all of those folks across the 4 counties, excuse me. So having an extra program would definitely be helpful. One thing that we are hearing at a state level is that for those of you who know Miss Kim Carson, she is quite the superhero, but she and her team have been holding up the legs of the continuum of care for a long, long time, and the state would like to see some additional partners enter the room. And so if you work in housing or interested in housing and homelessness in any way, please let us know and we can get you connected to Miss Kim Carson and Elena Martin. Any questions about the continuum of care? All right, if not, I will turn it over to Allison. Are you for veteran outreach?
Sure, yeah.
Thank you.
Everybody, I don't have a whole lot to highlight this month. I did want to make you all aware that I met with an organization called America's Warrior Partnership, and so they do suicide prevention for veterans, family members, service members, kind of similar to the population that that we serve at VA. So they recently were awarded a grant to help with the formation of suicide mortality review boards. The thing about them, and it's through Virginia, the thing about them is that they're headquartered out of Georgia. So they don't have anybody sort of on the ground permanently here. So what they're doing right now is a landscape analysis, and they were interested in meeting with stakeholders in various communities in Virginia, just to kind of get a lay of the land and see what type of suicide prevention efforts are going on currently and sort of where things stand. So if anybody's interested in meeting with them, they are like definitely, scheduling meetings and just trying to get a sense of all the different localities. And we all know that there's so many different regions in Virginia, and all the regions are different. So if anybody from here would be interested in talking to them, I can put my email in the chat and feel free to connect with me, and I'd be happy to connect you with them. That's kind of the major highlight that I have right now. Still continuing coalition work all over kind of Central and Southside Virginia, but as the holidays are coming, a lot of not so many events, but I'm sure things will kind of kick back up in the new year. So I'll keep you all informed of anything. And if there's anything as far as resources that you want to send to me, feel free to. I try to compile them and then send them out in kind of an email blast once every few weeks. So definitely let me know. Thank you.
Great. Thank you so much, Allison.
Awesome. I wanted to follow up with Allison. I did get your email about meeting with the American Warriors Partnership. And so I need to write an email. I was hoping to gather Darren, who does our adult outpatient veteran outreach, and then with Dennis and our leadership team to set up a time to meet with them to talk about what our coalition has done in the last year and a half or so in that effort. So I have it on my calendar to reach out to you.
Perfect. No
in the
worries.
next couple of days
Okay.
to see if we can set something up, because I know in terms of like different conversations by different folks, trying to get us all together in the same meeting with them would be great.
Yeah, I think so too. That's awesome. Thank you. And definitely, no rush. Feel free whenever. I know we're all wearing a million different hats, so whenever you get around to it.
All right, no worry. It'll be soon. And then Dennis is in the room, so he's probably heard me share that. And so I'm going to try to circle us all into some type of meeting with them at the same time.
Perfect. Thank you, Kenan.
No problem.
I did also want to give Dennis an opportunity. Dennis, do you have any updates on the veteran outreach front?
On our side, we're basically the winter we take off, but we will be having again 3 fishing trips for our veterans out of the hospitals and the clinics. Will be April, June, and September again next year. Veronica came to the one in September, and she can tell you, what was it, over 60 of them themselves?
It was
showed up.
amazing. Yes.
It's amazing to see these men and women fishing, their families, and just enjoying themselves. We also then, we will have twice a year that we take out families with special needs, and we're working with local businesses to create an all-inclusive park at Kerr Lake, Bugs Island Lake for all of us Virginia folks. It'll be Palmer Point. It'll have an 80-foot gangway, a 40-foot dock end. All of the restrooms will be altered. The landscape will be altered. There will be large beach wheelchairs. Those with the large tires so that they can all get down to the water and into the water. So this has been ongoing for a couple of years. The latest effort from us and the local community was there's now a new dock, handicap dock built at Occoneechee State Park for Virginia. So now we have Island Creek toward the North Carolina side, Occoneechee on this side along Highway 58, and then we'll have the other one at Palmer's Point. Again, all for handicapped. The other, I guess, final thing is we have 2 service officers in the local area, Rita Dixon out of South Boston and Jimmy Davis out of Clarksville. And the 2 of them average about 30 veterans every month working on their disability packages and getting them the help they need. So again, this for all your veterans around here, you can get through the coalition, through me, through others, but we're here to continue to assist them. The service officers, it's not just the veterans themselves. They have gone back to assist on widows to get their proper benefits years after their spouses have died.
Oh, wow.
So again, it's the assisting with that paperwork is very important. So any families that are associated with veterans, to include children, to still be able to get them back into what limited, but they still have certain VA rights. And again, Allison, you probably know a lot more about that than I do. But again, there are opportunities for these families to continue to receive VA and support even after that military member is no longer here. Any update from you, Allison, on that?
So I will say that the benefit side of the house is definitely not my specialty. So I don't want to speak out of school. But I do know, like you were saying, a lot of times the VSOs are able to help veteran family members apply for various benefits, everything from like schooling to continuation of disability, that type of thing. Usually we refer when veterans come or family members come and they want to kind of see what they're eligible for death benefits. We have somebody called a details clerk at our VA, and there should be one at every VA. And so they're able to provide resources about kind of those benefits that veterans are entitled to upon them being deceased. And then as far as like the financial benefits, so past the funeral benefits, usually a VSO is involved with helping families navigate through that process. Because the Veterans Benefits Administration is who handles kind of all of the financial side of things, whereas the Veterans Health Administration, that's more where I work. And so that's where we do kind of the healthcare related part of things, if that distinction kind of makes any sense. It's both, we both say that we're VA, so it's totally, I can see how people might have difficulty kind of knowing who to go to for that. But the veteran service organizations are really, they've been really key partners in helping veterans and their families kind of navigate that benefit side of things.
Great, thank you both. And thank you both for all the work you're doing. The veteran community is very, very important, and as we know, can sometimes feel very isolated in what they do and coming back. So appreciate you both. Next up, we have an update from our We Stand Together Summit that was held on October 12th in South Boston, Virginia. Kenan, I'm assuming you want me to give that update, or do you want to give the update?
No, you're welcome to. I'll say that one thing I will say is that Ellen worked together with Sarah to create a landing page for that. So when the newsletter went out just a few days ago, gave people the opportunity to see the many photographs and such in celebration of that event. But I'll hand it off to you.
Great, thank you. So as I said, this was a summit held in South Boston, Virginia. The goal of the summit was to uplift and celebrate folks in the LGBTQIA+ community. We focus on this as a coalition because this is a community that experiences substance use disorder and trauma at a disproportionate rate in comparison to peers. And so it's really important that we step up and help provide resources for this community. We did have almost 100 folks attend this year, so that was really, really exciting. That was jump from last year when our summit was held in Danville, but probably because Danville was a cold and rainy day, and this year we were blessed with a very, very sunny and beautiful day. But like I said, 100 folks came out, almost 100 folks came out. We had, I think, 14 different vendors present at the event. We also offered a Revive training at the event. The surveys we got were pretty positive. Folks really enjoyed the content of the day and the speakers. A lot of folks also said that they liked the breakout that we did for lunch this year. We did get a couple of notes on the venue, but they were things that we couldn't really control or change. And so we're taking all of those things in and planning for next year. But overall, I was pretty pleased with the turnout and with the speakers for the day. And so I think I definitely consider the summit to be a success in my book. Any questions, comments? I'm gonna check the chat really quickly. Will that be an annual thing? That's the hope, I think. It definitely, we have been fortunate the past 2 years in that the Department of Behavioral Health and Human Services has had 2 different grants. One is the Behavioral Health Equity Grant, which Southside tapped into both years. This year, Lean In also came in. Well, both years Lean In came from a grant. Last year we were Behavioral Health and Equity. This year they gave us something called the SOAR grant that is specifically tied to substance use and more specifically opioid use. And so all of that to say is that if that funding is available, we would love to continue this. If that funding is not available, I think we have very dedicated partners who are hitting the pavement already, trying to make sure that we have resource alignment to make this work. So yes, it is our goal that this is an annual thing. If anyone would like to be involved, I think we're still coming down from the most recent summit, so we haven't started our planning committee. But if it's anything like last year, we're going to start planning in around February. So if you would like to be involved, please let either Kenan or myself know, and we can get you pulled in pretty early. All right. Let me check the chat real quick. Awesome. Okay. All right. So if no further questions on We Stand Together, then I will turn it over to Kenan for an update on Drug Take Back Day.
Sure, absolutely. And I'll go ahead and say, I don't know why I itemized those 3 events on the same date in different lines. Just blame that on me trying to maneuver through the agenda. So happy to share that on October 26th, coalition members participated in 3 simultaneous events. So we were asked to participate on 3 events on the same day. Isn't that fantastic? So along with Southside Behavioral Health staff, we spread out and first of all participated in the Chase City Police Department's Drug Take Back Day on October 26th. We provided Rapid Revive during the Drug Take Back Day that they held along. We also provided lock and talk training where folks could pick up the locking medication boxes in support of suicide prevention and opioid overdose, or I should say any type of misuse of a medication is lock and talk. At the same time, Veronica and coalition members and other folks joined us in Boynton Day. In Boynton Day, we shared information not only about us in general as a coalition, but also, again, Veronica helped support us with lock and talk. So folks came by the table in Boynton and were able to pick up locking medication boxes in support of overdose prevention and suicide prevention. And then even more folks on the same day. We're in Alberta. The town of Alberta sponsored, I believe, their first substance abuse prevention walk there in the town of Alberta. And our team again set up both a lock and talk, so people were able again to utilize and pick up and hear and learn about the locky medication boxes we have in support of suicide prevention and opioid overdose prevention, and also Rapid Revive. I was the Rapid Revive trainer at Chase City at the Drug Take Back Day, and Amanda Hutchins, of course, one of our coalition members who works for the Southside Medical Services Corps, she volunteered to be our Revive trainer at the substance abuse prevention walk in Alberta. So it was a phenomenal day. We did submit to Ellen and Sarah a number of photographs from us all across the 3-county area. Really cool to be, two-county area. Really cool to be all present on the same day, 3 different events, 2 in Mecklenburg, 1 in Brunswick. And Sarah and Ellen again have created a landing page of sorts on our coalition website to showcase the efforts all on one day. So just wanted to give a big shout out to everybody that helped with that, because that was a lot of movement and a lot of setup, and it went really, really well. Beautiful weather, and great turnout at all the events. Thank you.
Thank you, Kenan. At this time, any questions on Boynton Day, the Prevention Walk in Alberta, or Drug Take Back Day? All right. Kenan and her team regularly prove that it is possible to be in multiple places at once. So shout out to y'all for everything there.
I love that. I think we should continue to do that.
Yes.
Yes.
Maybe
yes.
get t-shirts made too, defying the odds.
That's right.
All right, folks. If no questions or comments on those updates, then I will turn it over to our members at large for any updates we have from you all.
Hi, everyone. My name is John Morris, and I have a question.
Yes, good morning, John.
Again, hi, I'm John Morris. I'm a school counselor at Russell Middle School in Brunswick County, Virginia. I was made aware of this meeting in the Southside Wellness Coalition by Dawn Jones, educational diagnostician here in Brunswick County. So this is my first time here. I'm glad to be here. And I had 2 other colleagues, I believe, also from the school district here with me, Miss Seward and Miss Smith. What constitutes membership?
So if you'd like to be a member, we do have a monthly meeting. We have a number of events that we ask folks to attend as well, but we can get you connected. We can email Kenan and get you on our listserv so that you receive our updates. And we also, just ask that you attend the meetings and participate and share updates. We also welcome members to present at the meetings. So that's always an option if you'd like to present on the work you're doing or what you're seeing in the work you're doing. And so other than that, it's volunteer based, and it's just, supposed to be the community coming together to understand how we can promote wellness throughout the 3 counties.
Thank you so much for sharing that, Lim. I really appreciate that. And updates wise, I'm a school counselor at Russell Middle School. I am a sponsor for a Beta Club, and for the Beta Club here at Russell. Right now we're in the middle of a food drive. Last month we did for Socktober, we did a sock drive, and we collected socks, and we're going to donate them to the Power of One here in Brunswick County, that Mayor LaWanda Tatum is CEO of. Something that I have been seeing and been considering is how do we, in terms of promoting wellness, what can we do to support students who struggle with depression or anxiety and things like that? We currently don't have any school programs at large for the middle school to offset that challenge that our students are facing. So the thing that I'm wondering, and I guess I'm also seeking support for help with is how can I make that a whole school initiative, either through an event or a series of events, aside from the individual counseling sessions that I provide and interventions whenever sought. So that's what's up with me, and thank you all for listening. Oh, and I can put my email in the chat in terms of whatever's needed. I know you mentioned a connection with Kenan Tyner-Smith, so I'll definitely put my email within the chat for further connection. Thank you.
Great. Thank you so much, John. And I will say that the leadership team has, the initiative of the leadership team, they've identified that youth are a big push for the 2026 year. We're going to be doing a couple of events. Well, when I say events, we're going to be doing a couple of activities we currently have it in Halifax and Mecklenburg, but would love to connect with you too to see if we could set something up in Brunswick. I think we're looking at about mid-December for those events. So let's connect offline and see if it suits you.
Definitely, and I can follow up with John about information, about providing information about the children and family services that we currently have. As they mentioned, students who struggle with depression and anxiety, so I can share with John immediately some information about that. In terms, like you said, in terms of activities and events within the school, I'll reach out to see if we can have a deeper conversation about, obviously we'd have to get permissions and stuff like that in order to host outreach at the school. But yeah, that sounds like a fantastic opportunity. John, I'm glad you're here. We'll follow up with you.
Thank you so much. Thank you so much. Looking forward to it.
Any other member news or updates? I will say on my end, the Lean In project we do a holiday drive every year for we provide crisis services to folks in the LGBTQIA plus community, the holidays, and very specifically college age students coming home for the holidays is always time where we are very, very busy. So just want to let folks know that we are here, we are available. We do have funds to support folks in crisis. So if you have anyone, we can serve folks 18 and up immediately. And if we have youth who are experiencing crisis and need a safe place, we can work with that as well. So please feel free to reach out to me and I can help you get connected to our crisis services. Otherwise, for our training updates, our upcoming trainings, we have adult mental health first aid on December 3rd and 5th, and a virtual revive right before our next coalition meeting on December 18th.
Yes, and trainings that we are working on trainings right now that will be announced for the first 6 months of 2025 for both mental health first aid and revive and for Talk Saves Lives. But as always, we're always looking for new places, schools, churches, anywhere that we can provide the number of different suicide prevention and mental health wellness classes that we offer in addition to revive. So please let us know if you want to get a training on the calendar for 2025.
Sorry, I was responding to a question in the chat, just in case folks didn't see. So for the Lean In project, we are based in South Boston. However, our crisis services are statewide. If we do receive a referral for an individual who is in an area where there are prominent resources, we will usually provide an immediate crisis response, and then for long-term support, connect that person to the resource in their area. We have gotten a couple of folks come back and say that, that wasn't successful, and so we'll always work to serve folks there. But we are happy to be the first initial intervention for folks across the state. All right. So just a reminder that our next meeting is going to be a hybrid meeting on December 19th, beginning at 10 a.m. As the meeting link is here, we'll also send it out and you can find it on our website as well. Just a reminder, if you do want to speak at one of our meetings, we love to hear from you all and hear about the great work you're doing. So just let us know. We also have a Facebook and Instagram, so make sure you give us a follow. Keep up to date with what we're doing and the initiatives we're working on. And you can always visit our website at bewellsouthside.org as well for any information or updates. But if no one else has comments or things they'd like to share, that's what we have for you today, folks. Thank you so much for joining us. It's always a pleasure to be in this space with you. All right, hearing none, I think we can safely say meeting adjourned. Thank you all so much.
Thank you, Liam. Thanks, Kenan.
Thank you.
Thank
Thank
you.
you.